Good morning, Facebook and YouTube. Over the last 28 years, we have been teaching everybody how to take care of their spine at home, all right? Some of you are homebound right now, and so we want you to put into action all these things that we've taught you. And this is things that we've taught through Pedabond, Chiropractic Biophysics, the clear scoliosis method. You've been given home exercises to do. Now's the time to do them, okay? Keep your body healthy. Keep your nervous system healthy so you can keep your immune system working as high as possible. Now there's a few things that most of our patients do, so I'm going to review those because most people have a forward head, loss of curve in the neck. So I'm going to go over the things that we do to correct that at home. You each also have individual exercises very specific to your x-ray and your situation. So if you do anything that we teach you online, and it causes any symptoms at all, we want to make sure you call the office immediately so we can make some adjustments. We also are doing telehealth consultations now, so if we need to review what you're doing at home and I can visually see it and we can go over it, we can all do that remotely, okay? So when you start your home exercises, the first thing we're going to do is what we call the spinal twist. We want to warm up the spine to get it more pliable, to change back to normal. This is going to hydrate the disc. It's going to increase flexibility in the ligaments, tendons, and muscles, and it's actually going to generate heat in your spine. It's like if you have cold jello, you can't mold it, but if you have hot jello, you can, okay? So these are the spinal twists. We're going to do 25 of these to each side, and it's like taking a dried up sponge you find in the garage, you dunk it in a bucket of water, you squeeze it out, and guess what happens? That sponge comes back to life. That's what we want to do with your spine and nervous system. Then after we do the spinal twist, we're going to go through our isometric exercises. So for me, my isometric exercise from the side of the neck is going to be hands interlaced behind the head, pressing into the hands as hard as you can. You're going to do that for 5 seconds, then relax. 5 seconds again, and relax. We're going to do that 10 times. So most of you are doing that one. The other one is the cervical flexion exercise. Most people are weak in the cervical flexors. Believe it or not, they actually help to put the curve in the neck. And so we're going to be over a rolled towel. We're going to put our hands here, press into our hands as hard as we can, 5 seconds, and relax. Your head will not come off the bed or the floor. It will be touching it. You're just pressing. It's an isometric. So your head doesn't move. Head stays back here. This is bringing the curve in the neck. These muscles are bringing the curve in the neck. Then we're going to do your wall traction. Most of our patients have a home cervical repeat traction unit. It's time to start using it so you can take care of your spinal cord. This traction unit brings the head back over the shoulders, curve in the neck. Most people are doing this 30 times. The scoliosis patients are doing it 100 times twice a day. Look straight ahead, drop 50% of your body weight, and you should feel this get tension on it. So when you're doing that, you can actually feel that pressure coming off your spinal cord. It's really nice. So the first part, the warm-up, we call that the mix. The fix is the chiropractic adjustment. If you're at home, you're not going to be getting adjusted, but the isometric exercises are like mini adjustments to correct the spine. Then the last thing we do is called the set. So you're going to put your 2-pound head weight on and your glasses. Other patients may have different specific weighting based on what we've seen on their x-rays in the office. So this comes here. So initially this weight's going to make your head go forward, but then your body realizes that happens, comes back over here. The prism glasses are blacked out at the top, so it gets you to hold your head up so that you're, again, putting the head back over the shoulders, curve in the neck. So we have you stand on something unstable like a wobble disc to hold that curve to create some instability, And that gets this to be more of a postural exercise. You have two different kind of muscle systems in your body. Regular muscles that we use every day, where we can just tell the muscle to contract, and then your postural muscles, they're working on your own, like your heart beating, your lungs breathing air, your kidneys working. Those things are happening subconsciously. And your posture does too. So when you challenge your body on something unstable while you're putting it in a better position like this, it's getting the brain to get those postural muscles to hold everything in position. So you can see that while I'm doing this, my ear is over the shoulders and I have a good curve in my neck. So I'm training my body to do that, which takes the pressure off the nerves, and it's getting to get it to hold for a long time. So not just a quick fix, but an actual change in your spine and nervous system to get the correction to hold. Okay, so that's called the mix, fix, set. What we just did was part of the set. And then the last thing we're going to do is called spinal molding. We're going to lay on some rolls to get the body to stay in that position, okay? So the curves in the neck head back over the shoulders, and we can lay like this for 20 minutes. The spinal weighting we can do for 20 minutes. So all together, if you do all the exercises, it could take as much as 50 minutes to do everything, okay? All right, so we've been teaching this for 28 years. We've been teaching you how to do it. Now's the time to put it into action. Take care of your spine every day. Your nervous system can only work as good as your spine is working, and your immune system can only work as good as your nervous system, okay? So this is Dr. J. Hartley, Hartley Chiropractic and Scoliosis Center, St. Augustine, Florida. If you have any problems with those instructions, give us a call at 904-679-3233, and we can set you up for an in-office or a telemedicine visit. Have a great day.